miracles. And today we're going to be talking about the prostate gland and erectile dysfunction due to the high prevalence today, and often not talked about, not spoken about, and people find they're lining up in the queue and they're just becoming another one of those numbers without really getting to the cause of disease. So I'm going to spell it out today, and there will be a part 2 next week, because I can see already that there's too much information almost for today. But that's fine. Feel free to ask your questions in the chat. And I hope that by the end of today, you've got a better idea. I'm not going to be using all the terminology where I get struck off YouTube and so on. So I'm going to be using the word prostate degeneration and erectile dysfunction. And I think you know what that means. So just moving straight to the slides, I want to start there, and then we can having a look specifically here at prostate degeneration and erectile dysfunction. What is, I've got a brilliant case study, and I think this is what prompted me to, really share this kind of information, that there is hope out there. There's a lot of hope, and we get people well, which is good. So what I'm going to be sharing today is facts, and 29.4% of prostate disease is prevalent today amongst men. That is absolutely huge. 24% of prostate disease. And then when we're talking about erectile dysfunction, that's affecting 322 million men worldwide. And in the biggest age group gap, which is 55 to 64, 34% of men, that's a third. So a third of men have got prostate degeneration, disease, rather, let's call it disease. And then 34% in the 55 to 64-year-old age group are experiencing ED. And we have case studies, clients where erectile dysfunction is affecting young men as young as 27 years old. Something's wrong. Let's have a look and see. So starting off with the understanding of the prostate. It's part of the male reproductive system. So the gland below the bladder in front of the rectum, the size of a walnut, it weighs about 30 grams, it's tiny. It can grow to the size of a lemon, and as the male gets older, it does increase in size. It's made up of connective tissues, which is protein, and glandular tissue covered with the prostatic fascia. Its function is to add fluid to the semen, and its muscles help push the semen through the urethra. As I said, it naturally gets bigger with age, and in female, the gland equivalent is called the Skene's gland. So that's really what the prostate is, very, very vital and very part of the reproductive system indeed. Because you need fluid, otherwise it's just dry. So it's made up of 5 lobes: the anterior lobe in the front, the posterior lobe in the back, lateral one on each side, and then a median one in the middle. And you can see there coming in through the rectum, that's where you can actually reach the prostate gland the easiest. And I'll talk about that a little bit in a moment going forward. So here we're talking about the symptoms of prostate disease, prostate degeneration. So one of the things can be, but this is not definitively prostate degeneration, but you can get benign prostatic hypertrophy and urinary symptoms. And that is the benign prostatic hypertrophy is enlargement. So it's larger than it should be. It can press on the urethra and cause urinary disturbances. Most males along the line will experience some form of enlargement, but this is not degeneration. So I'm going to get to the causes in the moment of why the prostate can go out of alignment. In terms of exactly prostate degeneration, it's the second most common cause of degeneration in man, affecting urination and causing pain in the area. Some of the symptoms would then be pain and discomfort, blood in the urine, urinating difficulties, incontinence, and erectile dysfunction. Erectile dysfunction becomes a big problem if you've had the prostate removed in any event. So people have a problem there. Just this is information for you to know. Inflammatory prostatitis. This is when the tissues in and around the prostate become swollen and tender. This is the third most common urinary system issue in males less than 50 years old. So we can get inflammation, and that can lots of causes: calcification, parasites, infections, toxins. In the male reproductive system, the gonads especially, is where you'll find a lot of vaccination residue just due to gravity. The toxins do gather in the gonads. So we want to make sure that we've got good blood flow. I'll speak about that in a moment. Calcification. So this is a big one, because if the body's acidic, we're going to calcify. And we calcify in the areas where there's little flow. If you think of the sea, the coral forms around the corner of the rock where it's not subjected to tidal wave water movements. It grows where there's not a lot of movement. So this is the thing. Young boys, young men are sitting all day. They're in front of blue screens. You can see I've got my infrared lamp on, deflecting the blue light from the screen. But they're literally sitting there. They probably buying takeaways. They're not getting up, and the blood flow reduces. So therefore the coral will grow. If they're acidic, it will definitely grow. And then it will become infected, and toxins will reside there. So this is where you start getting the big problems, and this is what we see. And I'm going to refer to the case study in a moment to show you what we did and what we found. So apart from enlargement, we've got calcification as well, and we've also got cell hyperplasia. I'll talk about that just in a moment, but let's focus here on understanding what a PSA reading is. So people go for a PSA reading, which is a prostate-specific antigen, which they measure the specific protein produced by the prostate gland in the blood. So it's a blood reading, and here are various readings. And the case study then I'm going to bring you to, the man was between 70 and 79 years old, and his PSA was 2.4. So it's really, really a phenomenal case study. But this just gives you an idea of how the PSA readings shift as age increases. However, an elevated reading also doesn't automatically diagnose degeneration. We need to use something like the NQB, formerly SCIO quantum device, where we can actually identify cell hyperplasia. Cell hyperplasia means normal cells have become abnormal. All right, and I also measure that with the quantum Q450. It tells us cell hyperplasia, calcification, enlargement. So those are your main predisposing factors, if you like, to disorder there. And some of the causes would be poor nourishment, poor detoxification, high stress levels, lifestyle, as I said, sedentary, going to sleep late, lots of blue screens, emotions, and that's always the root cause beyond the physical. There will be often epigenetic inherited generational patterns that repeat. For example, dad could have a prostate issue, so could son. And the emotion would pass through it. It can be any emotions: anger, fear, sadness, hatred. It just depends on the experience before you were born or while you were born. And those have to be removed, because you can fill the table with products, but unless we've got to the root cause beyond the physical, we're still missing the point here. And that's when you can get a clear reading and you get a remission, because the root cause was never removed. So that's a big problem. Also, insufficient massage. The prostate gland does need to be massaged, and that brings in health, vitality, and also ejaculation, because that fluid should be re-assimilated into the body and sent up to the brain, the organs, the blood vessels, the circulation. So this is known in the Eastern medicine, Eastern medical doctors. know about the last 2 points. And I'm bringing this to the fore because I've done a lot of research now and also with my clients. And we're seeing this little gland's been totally forgotten about. And no wonder. And the same for the females. I'm going to do a female webinar as well, where we see from a sexual aspect, there's been also certain things forgotten about which lead to the breast cancer and the uterine cancer. So it's really fundamental what I'm speaking to you about. And we need to discuss this. And anybody who needs to phone me, please do. This will be put on my YouTube amongst the other 400 or so educational videos I've already posted. This will be uploaded anyway tomorrow. But I really do think we need to get into a deeper discussion on these vital aspects of the body. If you don't lose these things, they disappear, they cause problems. So most people who have prostate degeneration and have the prostate removed will end up with erectile dysfunction. There's other causes as well. I just want to say that at the outset, which is the inability to achieve or maintain an erection firm enough for sexual intercourse. And it's really, really problematic. As I said, 322 million men worldwide, according to the stats. That's a huge amount. And, a third of men. So let's have a look at the causes, because if we can fix those, we can really move mountains. Obviously, emotions, and I'm just going to go there first, is paramount. We need to come and do that whole process of mind, holistic ancestral orientation, where we remove those generational repeated patterns. All right, as well as waking ourselves up to proper sexual energy, vitality, good nutrition, detoxify, the role of hormones. I'll speak to you about the case study in a moment, the role of stress, the importance of exercising, not smoking, not bringing in alcohol, those kind of toxic poisons. There's a marked effect on people, absolutely marked effect. The lack of the massage, actual ejaculation, as I said, that different to orgasm. The hormones, so often the testosterone levels are low. And there may well also be estrogen and progesterone sexual hormones low, as well as others. We often get also low neurotransmitters, serotonin, dopamine, GABA, PSA, those also can be low. And, stress plays a very big part in that. So circulation, limited blood flow. I'm going to talk about the VitaFlow in a moment, because apart from increasing circulation, it also increases naturally nitric oxide, which is crucial for vitality. And once we get the circulation flowing, the vitality up, we start enabling the brain and the body, rest of the body, to connect. All right, and that's crucial. And from an emotion point of view, you're as a person to be connected, body, mind, emotions, and spirit. And further than that, on a chemical level, an alchemical level, there needs to be chemistry between two people for everything to flow properly. As I say, I can talk about that another time. And then obviously the good detoxification. So it gets back to proper care of the body, self-love, and I haven't even included in here sunshine, earthing, breathing, hydration. Those all go without saying. Circadian rhythms, these are all very, very important. So it's important what time you go to bed, because after 10 o'clock, the serotonin, melatonin cycle switches over. And if you go to bed too late, you miss that switch over, which is crucial for vitality and also crucial for the nervous system to relax and the immune system to restore itself. So there's many root causes that apply to both prostate degeneration and ED. So with my halo process, we go through the benchmark assessment, and we're using various quantum devices and a live blood, and we see exactly the coagulated blood, the rouleau, the red blood cells, the parasites, the excess protein buildup, for example, liver problems, hormonal problems. And, if there is actually degeneration, we see that as well. And we address these root causes, paramount, which ones I've talked to you about. And then we come in with our reset, restore, rejuvenate, the third process, where we bring in our elements to help shift. The 365 Healthy by Choice signature range, which I'll show you some of the products now. Also, our protocols to deal with this disorder. And we realign with the quantum machines too. We do a series of oxygen drips, which are fundamental and magnificent. They're just miracles. We bring in saunas as well, because that will help detoxify. And then acupuncture works also emotionally, as well as the how work. So we're going to work in a nonverbal way to release the emotional burden, and then people can start fully functioning in life, and not shouldering the childhood experiences or the generational experiences. And that's the most freeing. That's when you feel the most peace, the most joy, the most freedom, the most happiness. And that is my aim for people, to think clearly, live productively, thrive 365 days a year in the realm of peace, joy, freedom, unconditional love. We have to love ourselves first. So this is all very important. And then the last one would be in my halo process is rejoice, where we remeasure, we check against the benchmark. Not only does the person look better, reporting feeling better, pain's gone, urination's increased, erectile dysfunction disappeared. In fact, in this case study, 1 month, and it was actually earlier than 1 month, but we did measure after a month. Everything starts coming into order, and it's not only just revolving around the prostate, the whole body, the heart, the lungs, the kidney, the gut, the skin, the spleen, the vessels, the brain, all start functioning on a much higher level. And this is what we call evidence-based medicine. So there's research, we measured it, and the client's also telling you that they're feeling better, and they have joy, and they're sleeping better, and everything else is coming into accord. And the parasites are out, and the toxins are out. So here's our case study. A man 76 years old. I've actually got his case study here with me. And he'd had this degeneration for a few years, by the way. He was acidic. He had low oxygen. He had low fatty acids. And you're always going to find low fatty acids when there is degeneration. This is the flaxseed oil. And flaxseed oil is crucial because it forms the membrane around the cells. It's part of the membrane, and it blocks viruses and that entering into cells, which is crucial. It creates an electrical potential for food and oxygen to enter into the cell. So that's a really crucial nutrient for prostate degeneration. Anyway, we use it with erectile dysfunction as well, because it's part of my 4 reset items: the flaxseed oil, microbiome reset, cell oxygen, and DMSO. And I have all of those here. So there's the DMSO, plant tree sap. There is the microbiome reset. There's over 80 live strains. And the cell oxygen. In this gentleman, I also found low minerals. Minerals are crucial because minerals are what charge our battery. And if we're not charging our battery, how are we going to heal? You can't fix a cell phone that's where the battery's flat. You need to charge it. So the beginning point is the minerals. Shilajit, which I have here. The Shilajit minerals. And then also the almost gold. Gold, silver, copper, nickel, all the platinum, precious metal minerals. So those are lovely minerals. We've done the oils. The other thing I'm going to bring in now is proteins. So my peptides, the RNA, DNA, replica peptides. So these 5 building block peptides build every single amino acid sequence link that you could want in the body to support protein growth, hormones, enzymes, neurotransmitters, whatever you need. So you don't need to go and take and spend a fortune on often synthetic, mostly synthetic amino acids that are being thrown around on the various news feeds that cost a huge amount of money. Here you have everything in one bottle. So you've got your minerals, you've got your oils, you've got your proteins, and you've got your effective microorganisms, probiotics in the microbiome reset to digest all the food 100%. So we're not encouraging worms and that, because the whole body's integrated. So the gut is integrated into all of this. We've got to purify everything, steam clean everything. That makes me very happy. So we got to bring these minerals in. We also have an alkaline replenish electrolyte with boron. And often people need iron. He needed iron. The importance of iron is that it grabs the oxygen in the blood and carries it to the cells. So we would bit silly by giving by giving oxygen and not making sure the iron levels are high. And then parasites and toxins. So here we're going to be bringing in our para-immune defense, which the gentleman took. Just trying to get the reading for you. Para-immune defense. And that's got 7 of the top major antibacterial, antiviral, antifungal herbs. And we use this specifically for degeneration. And then we also noticed a whole series of toxins, chemical, environmental. Radiation was nailing him. And that's a silent toxin, the effects of radiation on people. And that'll definitely damage the genetic code, damage your immunity. Heavy metals, he had them, and then we noticed calcification. That's where we use our DCalciX, which is chunkapiedra based with another 5 specific nutrients to decalcify the body. And the issue here is that calcification, which is like coral and grows in areas where there's no flow, will then inhibit the release of urine even further, which makes it even more difficult because it starts calcifying in the urethra and so on, inside the kidney and inside the in and around the prostate. So we're definitely going to use DCalciX to decalcify this person, this client. Insofar as hormones are concerned, I've got the male hormone balance. And I've also got a natural testosterone tribulus. The tribulus is in the male hormone boost. And there's also a whole host of about 10 specific herbs and special nutrients to balance in the male testosterone and also other hormones like estrogen, progesterone, adrenal hormones. And also we've got hormone builders. So they're there to help the body start building their own. So very, very important. And the male hormone's got a little bit of pine bark, but where we have a lot of pine bark is in our VitaFlow. Let me just see where I put that. Oh, here we go. So this VitaFlow is crucial because, as I said earlier, this one increases circulation between around the whole body. And this whole thing with erectile dysfunction is the brain and the rest of the body must be connected. So we saw in our brain that we disconnect from our body and then we expect our body to function. So the VitaFlow increases enormously circulation. I mean, apart from prostate, you must see the effects it's having on people with raised veins that have all big purple mass of veins, for example, bottom of the ankles, other varicose veins, any disease that where we need to bring in circulation. And the 2 major nutrients in here are pine bark extract and grapeseed extract, both of which naturally produce nitric oxide. It's also got a bilberry, a horsetail. Horsetail's good for, it's got high in silica, so it keeps the rigidity of the cell membranes. We've also got the citrus bioflavonoids and dandelion. So it's a real combination here, very high antioxidant, by the way. So you wouldn't really even need to take vitamin C or anything because you're getting high amounts of antioxidants, which is also good for clearing in addition to the oxygen. But the most important thing is that we're getting flow. So also those young boys or people getting married, they'll come in on Thursday into the health pharmacy. I'm getting married, help, what am I going to do? I'm getting married on Saturday. So we would always bring in the pine bark related, which is the VitaFlow. So that's incredibly important. And then you're going to look again at the lifestyle, exercising, moving, sunshine, earthing, breathing, hydration, nourishment. So we did all of that with this gentleman. And we put him onto the saw palmito as well. And amongst other things, he needed a gallbladder flush because the oil wasn't getting digested in his body, and he was calcifying gallstones. So the bile wasn't coming out. So we needed to get the bile to come out. And we also needed to stop the acidity. So vitamin D and K and magnesium. We gave some enzymes. And we actually gave some zeolite too, because zeolite will grab the uric acid. So this is what we gave the gentleman. And then, I mean, just look at these results. I was absolutely staggered. So the PSA went from 16 to 2.4 in such a little time, 2 to 3 months. That is just huge. It's not seen today. But this man was absolutely fastidious. He followed everything to the letter. And the erectile dysfunction was restored in 1 month. And that's also, it's a record, actually less than a month. So just look at this really, really phenomenal result. And if you think about that slide I showed earlier, where I showed you age in the person in their 20s and 30s, they should be on 2.4. This man is 76. And he couldn't sit properly. He was aware of his prostate, and all of that settled. That's evidence-based medicine. I measured it. All of this is researched anyway. We're using all my natural 365 Healthy by Choice products. And he was able to achieve this. So I really do commend him and honor him for trusting natural health and well-being. And he achieved it, and he's come in absolutely sparkling. His teeth are pure white from the oxygen drops. His eyes are bright and shining. His skin is beautiful. It's got life flow in it, life force you can see. And this is one very happy man. And we are in the age of prevention. So apart from being able to realign people, I really want to draw to your attention the people who are listening and to share, it's about prevention. So we don't want these things to happen. So we want to eat properly all the time. We want to eat the berries. We want to eat drink green tea, minimize dairy, wheat, no fried foods, because that's what this man was doing. It just clogs your blood, and it's food for parasites. It's a free radical. It's cancer forming. So we can't consume heated oil. This is a new thing. Our great grannies and grandpas never cooked with oil. They used water. So we really do impress those aspects on people. And I like the blood group as well, because the blood group will point you in the right direction in a non-inflammatory way. And the science is there. They've done the work on the microscope. So they see. If you're an O blood group and you eat ever, what's going to happen? The red blood cells will form rouleau. So they know. And the objective of my practice and what I'm aiming for is I want the cells open. I want them ready and healthy to carry the oxygen and the food. I want ATP to be produced in the mitochondria, through oxygen and charged electrons. And I want the nuclear peptides, the 5 building block peptides from the replica RNA, all to be in the cell, so that every mitosis that happens, I'm getting a perfect cell that's formed, so that we're moving out of degeneration and into health. So this is my process that I do and I follow, and people come in and enter. Everybody's unique. If you want to book your assessment, there's my number on WhatsApp, please. And go and have a look at the shop. We do have sales on every month. So there will be certain products on sale and available for you. You're normally about 15% off or so. please go and have a look there. And, I'm just going to end off by thanking you for listening. I really do appreciate you coming in every week. And, let's look at thinking clearly, living productively, and thriving 365 days a year. We want to be fully functioning humans, living the life to the full, feeling great, and doing what we love. So with that, I'm going to end the actual slide presentation and just say to you, get hold of me as soon as you can. Yes, the underlying problem with ED is heart disease, blood pressure, and diabetes. Those 3 chronic metabolic diseases. That's absolutely true. So I always look there. Thanks, Rocco. I always go there first, and we clear the vessels, we thin the blood, we get the heart happy, we remove the blood sugar problems, the blood comes down automatically, and then we've got luck. We don't have erectile dysfunction anymore. So it's simple, actually, but you need to do the work. I can't do it for you. I'm not going to heal you. You're going to heal you. So, yeah, good luck, everybody. I've just it's the tip of the iceberg today. And next week, I'll do part 2. And by all means, send your questions to me on the WhatsApp, and I'll address them. And, this is a major problem worldwide. So let's not make it that problem anymore. Okay, it's over to you all. It's over to you now. Thanks very, very much.